I'm Kayla. I'm a student nurse today, and I will be performing a newborn assessment. I will come in, close the curtain for the privacy, wash my hands, do hand hygiene, come over and identify my patient and newborn using 2 identifiers, name and date of birth, making sure that matches up with the parent and mom as well. Then I would begin with the history. Baby's initials are BD. He was delivered vaginally, weighing in at 7 pounds, 2 ounces. Then I would go ahead and want to measure his length. I would take my tape measure, go all the way up from the hand, extend his leg, and I got about 50.8 centimeters. There was no significant maternal history or complications during this birth. Neonatal labs that I would collect would be hemoglobin, hematocrit, glucose level, and then a blood test of the heel to determine if any PKU was detected. I would then go ahead and start with the vital signs. I would take my patient's temperature, auxiliary temp underneath the armpit, just like so. Then I got 98.6 or 37 degrees Celsius. Normal temperature ranges are 97 to 100.4, so nothing to worry about there. My patient seems stable. Newborn seems to be within normal ranges. Then I would go ahead and take the pulse, make sure all peripheral pulses are palpable and strong, which means good circulation. Alright, pulse seems to be 140 beats per minute. Normal range would be 110 to 160 beats per minute. Everything seems to be stable there. Then I would check respirations. So I would go ahead and watch the chest rise up and down. I got 42 breaths per minute. Normal respiration range is 30 to 60 breaths per minute. Everything seems to be stable there as well. The gestational age of him is 38 weeks. I would go ahead and assess his head. I will want to check the head circumference. I will grab my tape measure again. I would place the tape around the head just above the eyes and eyebrows. Alright, I got 33.02 centimeters for the circumference. I would identify the fontanelles. There should be 2. Anterior is going to be diamond shaped. Posterior is going to be triangular shaped. I'm going to assess them, make sure they're open, intact, make sure they're soft. I want to palpate them. Slightly depressed but not too depressed. Too depressed could mean that there's some dehydration there. Then I will make sure their sutures are present. Sutures are where the bones meet in the head. Alright. Then there seems to be some molding present. Head seems to be a little bit elongated. That could be from pressure during vaginal delivery as well. I want to make sure the skull is soft and flexible. No swelling, edema seem to be present on the head from external pressures during delivery. No accumulation of blood underneath the scalp, which is always a good thing. Facial features seem symmetrical. And then I would go down and inspect the lips, open the mouth, inspect, make sure that the gums, palate, everything in there, mucous membranes seem to be pink, moist, and intact. No thrush, no fungal infections. I will place a gloved finger, or I could use a nipple of a bottle. So I would go ahead and insert that, checking the sucking reflex. Test positive for the sucking reflex, everything seems good there. Then I would check the brooding reflex. So then I would simply brush on one of the cheeks, and the baby's head should turn towards that side, and arms and legs should be flexed. Test positive for that as well. In the mouth, once again, I would look for Epstein pearls, which is epithelial cysts that seem white in color. I see a few of those, but there's nothing to be too concerned about. They'll go away after a little while. Then I would want to check the eyes. I will want to make sure sclera is white. There might be some conjunctiva hemorrhaging, but that also could just be from the pressure during birth. I'll make sure eyes are symmetrical, no drainage, minimal edema. I would want to use my pen light, brush across, make sure that they both are bilaterally reactive, because if not, that can mean a neurological disorder. Everything seems to be fine. Pupils are equal, round, reactive to light and accommodation. Then I want to take a look inside the nose. I want to make sure the nares are patent, that the airways are open to promote oxygenation and breathing, no respiratory distress. Nose seems to be a little flattened, not too much to be concerned about, not too flattened, because that could also be from coming out of the birth canal as well. Then I would want to take a look at the ears. The top of the pinna is aligned with the external of the eye. The pinna is also formed, flexible. Everything seems to be good there. Then I would take a look at my patient's neck, make sure that neck seems short with skin folds. Then I would turn the head to the side, check the tonic reflex. Arms and legs should extend in a fencing motion. All right, seems good as well. Then I would want to take a look at my baby's chest, check the circumference. I would grab my tool again, my measurement. All right, chest circumference seems to be 31.02 centimeters. Nipples are right near the midclavicular line. Nipples seem to be symmetrical, pink. Chest seems to be barrel shaped. So then I want to go ahead real quick and take a listen to his lung sounds. Lung sounds seem to be clear. However, I do hear some crackles. That could just mean retention of amniotic fluid from the amniotic sac. However, that should go away. However, everything else seems to sound clear. No adventitious breath sounds besides the crackles that I heard. No use of accessory muscles, no respiratory distress once again. Then I would want to listen to the heart. I would want to listen at the point of maximum impulse. I would want to listen for a full minute as well. S1, S2 are present. I do hear a slight murmur, but that will continue to be monitored. We will continue to monitor that. All right, your normal rhythm with variation related to the respiratory changes. And then I will once again just want to check the pulses, make sure they're palpable and strong. I will want to check the femoral pulses, especially right and left. All right, then I will move on to the abdomen. I will want to once again make sure that there's bowel sounds present in all 4 quadrants. I would always want to auscultate first because I wouldn't want to interrupt anything that's going on internally. Bowel sounds are present in all 4 quadrants. They seem a little on the hypoactive side. Then I would want to take a look at the umbilical cord. Umbilical cord the color seems opaque. There's 2 arteries, 1 vein. Great to see. I will want to look at the genitalia area. Since he is a male, I will want to make sure the urinary meatus is at the tip of the penis, which it seems to be. I would also want to make sure there's creases and ridges within it. I would look at the testes, make sure they're palpable. And the scrotum is not enlarged. All right, then I would take a look at the legs. Legs are symmetrical, full range of motion. Let's see if that's the case. So you want to do a little bit of passive range of motion. Full range of motion. No signs of hip dysplasia. I would do the Barlow and Ortolani test. All right, no clicks present. Then I will want to assess the spine. I would pick up my baby. I want to assess the spine, make sure that there's a C curvature. I would want to palpate the clavicles as well. Assess the buttocks. Make sure the anus is patent. And then I know that he has a positive passage of stool because he had one within less of 24 hours after birth. He has all 10 digits in all extremities. All right, then I would take a look at his skin, make sure he's pink, warm, moist. I don't see any cyanosis, any jaundice, anything like that. Circulation seems to have good positive circulation. And then I would want to take a look and do maybe the Babinski reflex, Stroke the lateral surface of the sole in an upward motion and see if they contract. All right. I could do the plantar reflex, the palmar reflex. We did the sucking reflex. He seems to be a nice, healthy baby. I don't see any Mongolian spots on him as well, which seem to be blue around the back side of the buttocks. I'm not seeing those. All right. And then I will want to document this all into my medical record. And then I would always want to make sure I hand hygiene out, ask the mom if they had any questions regarding their child. And we would just continue to monitor him closely. So I would hand hygiene on my way out. And that's it. Thanks.